Good evening, everyone. Welcome to IMG Research Academy. IMG Research Academy, it's an online research academy where we talk all things clinical research. My name is Dr. Kobe Edwards, one of the pioneers. Today we're going to continue where we stopped last session. Every 2 Sundays we teach research. Today we're going to talk more on research terminologies, common research terminologies that we throw around all the time, like p-value, introduction, conclusion, abstract, different research terminologies. So you could be used to them, literature review, and so many. Dr. Elisha Momodu is going to be giving us this talk. He has given me an express permission to record it. We're also going to share it on our social media channel. It's part of the things that he does or that we do to voluntarily teach people clinical research. We've been doing this for 5 years plus, and we've got a great team. Well over 1,000 people attend our lectures. In addition to research that we do, we also try to see how we can help ourselves improve our careers and grow in our career spheres. After his talk today, we're going to also talk about March, and not March, but this talk is going to be recorded. We'll give people more 2 or 3 minutes. Dr. Elisha probably going to start at 7:07. People are joining us from all over the world, from Canada, from, the great continent of Africa. Dr. Eko, welcome. I heard your concerns. We're going to look into it to see how we can fit the time to fit everybody. But for the now, we're working at 7 p.m. Eastern time every other Sunday. Our general rule is to put your videos on wherever you are. Dr. Thega will help us to kick people out who don't want to put their videos on, except there's a unique reason, like me now, I'm at work, that's going to make you not to put your video on. Thank you, everyone. I'm going to put on my video. Dr. Elisha, you can start at like 7:05 or 7:06 or 7:07-ish.
All right. How's everybody doing? Can you guys hear me well?
Yeah.
Okay, cool. Because I don't know, sometimes my internet messes up, so I just want to make sure I'm as audible as possible.
Sorry, yeah. Dr. Elisha, before you continue.
Okay, so yeah, we're gonna try and just cover a bit of basics for when it comes to like research terminologies, concepts, but I'm going to be a bit heavy on the statistics of it, because I know that a lot of us have done some publications already. Some of us are new. We've not done anything about that. And so this is kind of like just to put everybody like on a plain level ground and bring us up to speed on what all of those are. And I know that there's a lot of us in fact, a lot of us ran away from so many things because we were running away from math, but then we ended up and having to deal with statistics in research. And so that's something I'm going to try and pay a bit more attention to explain some things in statistics. And the reason why that is important is because obviously you're maybe reading like a paper or you're preparing to publish one, and you have all these like statistical terms. You see things like, you might see something like CI in bracket, or you might see like a Z score, or you might see like a T score, things like confidence interval and things like that. And you're wondering, oh, what does all this mean? What's the significance of that? All those statistical significance, clinical significance, all those things. So we're going to try and touch on it as well as possible. So I'll kind of give you like a run through, like an overview of like what research is all about, but then I'll zone in on those like terms, those statistical terms and all of that we struggle with a lot of the time. So I'm going to be sharing my screen. Can everybody see my screen? Can you guys see my screen?
Yes.
Oh, okay, cool.
Yeah.
Cool. All right. So our topic is understanding basic research concepts, terminologies, and statistics. All right. And first thing we're going to do is we're just looking at the overview of like the research process. All right. And we have the reviewing like an available literature, formulating a question, selecting an appropriate research design, collecting relevant data, interpreting findings, and publishing findings. So what are we thinking about? The first thing is we review a literature, like available literature. So let's say we want to we want to do a study, right? We find something that we're interested in. We go and look at all the previous available literature that was related to that, right? We read that. We get interested in those topics. We read those topics. We read literature that is related to that. And then we notice probably a gap, right? We see, okay, let's say we read about hypertension, some maybe like in a particular population, and then we notice, oh, there's something that's particularly not spoken about, that there seems to be a gap that I'm trying to look for. I'm trying to find out about something, but I can't seem to find information about it. That is a gap. And it's usually called a research gap. That comes from, okay, I've read multiple literature on this, but then I notice a gap. And usually that is what leads to a question. That leads you to formulate a particular question on, okay, this is the area that I now want to focus on because I noticed the gap in this available literature. Or sometimes it could be that you might have read something and you just want to do a new study about it, right? Even though it already exists, you want to bring it from a different angle. That also helps you to formulate a question. And so you read a literature and then you review that literature, right? What you do is it's kind of like a summary of what already exists. That is the idea of what a literature review is about. You read what's already available, what information is already available. You open that up, and then to get to formulate your question, you then like highlight what the gap is in the literature that you reviewed, right? And that leads to the research question. And so you get to formulating a question. And then after you formulate a question, you maybe narrow it down to a particular thing, make it as specific as possible because you don't want it too broad because there's just probably going to be way too much or way too many material. And then you formulate your question. And then the next thing is to do select an appropriate design, right? Now, the reason why a design is important is because you want to be able to show that this is how I did my research. You want to show the method that I did it, the process by which I did that, so that if somebody needs to, will I say, in a sense, replicate that kind of design, they will be able to get the same kind of findings that you get. All right. And so that is important in making in like formulating that design is important in the process of the research or formulating or getting eventually to that publishing that you want to do. And obviously, I'm focusing more on, or will I say, I'm tailoring this more to the place of, oh, like most of us are going to be dealing with like publishing papers and all of that. And so um, this is kind of like tailored towards that. And so you've reviewed your literature, you've found a gap that has led you to a question. You formulated that question, you've selected a design, kind of like methodology of how you want to carry out finding out more information about this question that you formulated. And then the next thing is to find relevant data. And we have multiple places that we've used, and Dr. Ed has obviously talked about this before, and NHS, NIH, all that. And so you collect that relevant data, and you don't have to find that data by yourself. Okay, that data is already available in all these places. You can go pull the data, and then your job will then be to the next one, interpret those findings and analyze those data that you've collected. And after after you're done with all of that, then you publish your findings. All right. So that's kind of like a quick overview of the research process. All right. And then, so we're going to be thinking about, okay, the clinical research essentials. And the thing is, why why is understanding these basics of statistics, of these research terminologies, these concepts, why are they important for a successful publishing of a paper? And so the first thing is this: clinical research is a gateway to scientific advancement. So in clinical research, what we're doing is that we're bridging the gap between what we don't know and where the current health advance is at the moment, where healthcare is at the moment. And so it bridges that theoretical knowledge and the practical applications to improve health outcomes, right? And then the role of publishing is that it disseminates, it spreads this findings that we have, that we're trying to bridge the gap between the current state of healthcare and what we're trying to get to. That publishing, after finding you're doing all these research processes and you've come to a conclusion, now you publicize this so that it disseminates that findings to the scientific community. It shapes the medical guidelines and the practice. All right. And it's a significance of foundational knowledge. So understanding key concepts, terminology, and statistics ensures that there's accuracy and credibility in your research. All right. Is everybody following me so far? That's good. Have I lost anyone already?
Yes, please.
All right, okay. And so what's the relevance in understanding terminology and concepts, right? It's the foundation of quality research. So it's involved in designing robust studies in data interpretation and communication, and peer review and publication. So for designing robust studies, you see that clear terminology ensures that the accurate study designs are tailored to research goals. It also helps you to be able to be precise in your language. It helps you to be professional. It helps you to be able to communicate clearly with other researchers, but it also helps you to understand what other researchers have written, what they've published, and what they're trying to communicate to you. All right, so it's not too complicated when you're reading something and you can fully understand what's going on. All right, and so, like I said, understanding concepts is critical for addressing reviewer concerns and improving acceptance rates. All right, so now, how does mastering these skills help improve publishing success? Like we said, it increases your credibility. So understanding those concepts and statistics enhances your trustworthiness with your reviewers. And then it strengthens collaboration because you're able to communicate effectively with the statisticians, with multidisciplinary teams, and then it also boosts your publication rates. And research has shown that well-prepared research has higher acceptance rates when it comes to like more bigger and top-tier journals. All right, so now why do we need to know statistics for research? It is a pillar of valid research, right? So understanding statistics, it ensures validity and reliability. It highlights the limitations that are present in studies, and it also aids in the success of publications, right? So statistics, it provides the framework for testing whatever hypothesis. So let's say you have a finding, you've come up with a topic and all of that. Those statistics they help to be able to test all the hypotheses that you have, the guesses, your assumptions, everything you're going to find out. Statistics helps that. I want you to think about this. Most of the things that we know today, whether it's based on epidemiology or based on, we say, okay, this number of Black people more prone to this disease, or maybe maybe men are more prone to this, or women are more prone to that. The reason we can know that is because we have a foundation of statistics that have taken a poll or a pool of these people, they've collected data, and then they've been able to use statistics to interpret that data and come to a conclusion. And that helps us in healthcare and in clinical practice and all of that to be able to improve patient outcomes, right? So it ensures validity and reliability. It also helps reveal what biases are there and what limitations are there in the research, because it's when we'll talk about some things like confidence interval and like things like z-score and all of that, but you and sample means and things like that, and you see that a lot of the time there might be biases, there might be limitations that we have when we're conducting research, and it's able to help you to, first of all, identify that and able to communicate that as well. Because if, for example, most of the data that we're collecting from whether it's like the NIH or all these big databases and all of that, they are based on not on like entire populations, but on samples from these populations, right? And so we need statistics to tell us, oh, this is the amount of people that we are basing all these findings on, and this is how sure we are that this is related to the larger population. And statistics help you to do that. And then it also aids in publication success because strong statistical analysis demonstrate the credibility of findings to reviewers. All right, so what type of observational studies do we have? These are foundational research designs. We have cross-sectional studies, we have case control studies, we have cohort studies. These are things that a lot of us have already seen before, but to understand what's going on, cross-sectional studies, it's like you're taking a cross section, you're just zooming in to the present, what's currently available, right? So we're assessing disease prevalence and associated factors at a single point in time. So what prevalence is what is existing at this particular point in time, right? What do we have right now? If we just zoom in, if we are assessing disease, we go out there and it's like you cast a net over a number of people and we just bring that out and say, okay, what do we find among these people? That is cross-sectional, right? You're just focusing on what's going on at the present. Case control, on the other hand, compares individuals with and without a disease to assess past exposure. So you're taking people with a particular disease, right? So let's say you say, oh, somebody has hypertension, and you have another sort of people who don't have hypertension. And then what you then do is then you then assess them and look back at their history and say, oh, what were you exposed to that made you to develop the disease or made you to not develop that disease? But the whole idea is that you are using people with cases and people who are controls. So it's case control, right? So these people have disease and these people, and you have a control group that do not have a disease, right? And then you're assessing them and you're trying to trace it back to see, oh, what happened? Why did they develop what they developed, right? And then you now have cohort studies. So remember, cross-sectional is you're just looking right now at what's going on. Case control, you gather people with a disease and you look back at why they have the disease that they have and why the people who are on the other part do not have that disease, right? Cohort, on the other hand, exposes people to a risk factor that can lead to a disease. So you get a number of people, and then you can have a prospective cohort, and then you say, okay, we will study these people over time, we'll expose them to this particular thing, and then we'll see over time. So if we say, oh, this set of people, they are smoking, and this set of people are not smoking. Now, none of these people have a disease, but then we follow them over time after being exposed to this risk factor. And then over time, we'll see who develops that disease and who doesn't develop that disease. All right. Any questions so far? Are we clear? Okay, I'll take that as no question. And so what are characteristics of a good research study? So what are characteristics of a good research study? You have things like randomization, blinding, adequate sample size, reproducibility. All right. So for a research study to be good, it has to be randomized. In other words, you can't just focus on a particular set of people that does not represent the total population. So, for example, you have blacks, you have whites, you have Hispanics, you have males, you have females. If you're trying to do a research that covers everybody and you just go and take only men, that's not going to be reflective of the whole population. And so it has to be randomized. And you have to do this at a random because if you decide, another thing is if you only take sick people, the results will be skewed because it's only sick people you took. You didn't take healthy people. So you want to get a population for the study that is representative of the whole population, and that's what randomization does. Blinding means that the people who are doing the study, the person who is being studied, they don't know. So, and you can have a single blinding, double blinding, or triple blinding. And what that means is single blinding just means the people who are being researched on, they don't know what's going on, right? And that means they can't behave in such a way that it can skew the results, right? And then you have oh, sorry, chat. I thought that was a question. Okay, and then you have double blinding, where both the researcher and the person involved and the people who are being researched as the study subjects are unaware. And then you have triple blinding, where like you have the researcher, you have the people who are being researched, and you have like an outside body as well. All of them are blinded. And then you have to have an adequate sample size, right? And these findings have to be replicable or reproducible. All right, so what phases of clinical trials are there? You have things like, so if you ever see, oh, like there was a phase 1, there was a phase 2, there was phase 3, understanding what this means is important. So phase 1, we know that assesses for like safety and toxicity. So basically, is it safe, right? You get a small group of test subjects, you find out how does the drug work, how does it work in the body, what effect that the body has on the drug, that's from pharmacokinetics and pharmacodynamics. And then phase 2, you're trying to think, okay, after we know how it works, we want to see how effective is it and what dosing are we giving, right? And then phase 3, after establishing all of that, you're comparing it with, because you're testing a new drug or something, or doing a new research, right? And so you're comparing it with the current standard of care to see, is it as good or is it better? All right. And then phase 4 is like, okay, after this thing has been distributed over time, it's like we're getting feedback on can it stay in the market, or do we need to recall it and do some more work or cancel it and all of that. All right. And so let's see. So over here, we have things like bias and study errors as well. And biases are things that skew a research. A research study, it could be that maybe the people involved in the research, they could have recall bias. Maybe they don't remember, they don't recollect information well. You can have a selection bias where, like we mentioned, the people that you select are not representative of the population. You can also have a measurement bias where there is a problem with the way things are measured, and you have confounding bias where there is a misinterpretation because of some kind of external factor. So, for example, somebody might do a pulmonary study, and then because the person smokes, that's a confounder for that study. All right, so now we have foundational statistics for clinical research. We have things like descriptive statistics, we have inferential statistics, and we have tests that for this statistics. Descriptive statistics will be things like measures of central tendency, like mean, median, and mode. And then you have standard deviation and all of that, measures of central tendency, measures of dispersion. And then you have other things like inferential statistics, like doing like a null hypothesis, alternative hypothesis, p-values, and then you have tests involved with this. So let's quickly take a look at this concept. So things like mean, median, and mode, these are measures of central tendency. The reason why we need to know about this, right, even though it sounds very basic, a lot of us did this in like secondary school or something. Now, the reason why this is important is because when we're talking about things like confidence interval and all of that, they are related to this. And the reason is this: if you know what a mean is, it's an average, right? But then when you're dealing with a particular population, there is a population mean. A population mean is like, okay, I go in to do a research and then I take a mean of everybody in that population. Let's say there's about 100,000 people, right? That's a whole population of people. Now, if, for example, you don't have the the um, the ability to perform a mean on that larger number of people, you want to take a sample of that mean that you want to use to be able to estimate what the mean in that population is. You want to do an estimate. So you take a sample. Now that sample, when you take, let's say there are 100,000 people in the population. Now, if you take a sample of 100 people and do a mean around that, then you're getting a sample mean. Now, for you to be able to say, okay, how can I be sure that this sample mean is close or is indicative of the population mean? This is where a confidence interval comes in, and where you have things like z-score and all of that. So that confidence interval is this: you take that sample mean, and then you create a range of means from that sample mean. So let's say you decide that, okay, you want to take the average age of, let's say in a population, right, of 100,000 people, you take the blood pressure of everyone and you do an average. And then you find out that the average of that population is 120/80. All right. And then you take a sample of that population, let's say 100 people, and you do uh, 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 mean, an average, and then you get 110/70, right? Now, that's not the exact mean, but now how can we make sure that like this mean that we get is related or is a good estimate? This is where confidence interval comes in. So through the z-score, we are able to create a confidence interval where we have a range of values that range between let's say if you have a mean of 110/80, we get from like 100, let's say 100 over 60 to 130/90, right? Now, our actual population mean, remember, is 120/80. So this range creates a safety net where the true population mean can fall in. Now that range is our range of mean that relates to our confidence interval. Now, what that confidence interval is, when you see 95% confidence interval or 99% confidence interval, what that is saying is that I am 95% confident that this range of values that I've gotten from my mean, it means that the true population mean is likely to fall into the value of the true population mean is likely to fall within this range of values. And if I have a 99% confidence interval, it means that I'm 99% confident that this range of mean is likely to fall within this range of values. All right. I think my time is almost done, so I have to just rush a bit. And then we have things like the hypothesis. We have type 1 and type 2 errors, and we already talked about confidence intervals. We also have common tests that test these statistics, things like t-test, ANOVA, which is analysis of variance, and chi-square test. And what the t-test measures is like you're comparing between two different means, right? And when you have more than two sets of means, you use analysis of variance. And then the chi-square test examines differences between categorical outcomes. So you're not really testing means you're testing more of proportions, like percentages and things like that. Let's skip over these ones. So usually when you're talking about like correlation in statistics, it just means if there's a positive correlation between two things, it means as one increases, the other one increases as well. If there's a negative correlation, it means as one is increasing, the other one is decreasing. If there's no correlation, it means there's no relationship between the two. And so understanding study results, it helps us to interpret graphs. You can have statistical significance and clinical significance, and we already talked about confidence intervals. We talked about z-score. So z-score is used for measuring confidence interval. Now, there's also something called a t-score. So usually, z-score will be used when the standard deviation is known. What standard deviation is what it just means is this. There is a standard measure, right? And then the deviation means how much do those values deviate from the standard. So let's say we want to find out the distribution of blood pressure in a population. Now the standard is 120/80. Now the standard deviation measures how much among the population, all the values we have, how much away from that standard do the ranges of people's blood pressure, how much does it fall? So now when that standard deviation is known, you use a z-score to then calculate the confidence interval to get that range of values for a sample, right? When the standard deviation is not known, you use a t-score, all right? And so basically in conclusion, the reason why we learn statistics, the reason why we need all these basic terminologies and concepts for understanding clinical research is because it helps you to be able to analyze your data. It helps you to be able to understand what you're reading. It helps you to be able to communicate effectively. It helps you to be able to interpret your findings, and it helps you to be able to communicate with researchers, to be professional, and it's important for foundational knowledge. Helps you to master the basic concepts, is crucial for valid research. It also equips you researchers to design, to analyze, and to publish like impactful studies. And it's a call to action to commit to continuous learning and to enhance our skill in clinical research. So thank you for listening. Does anyone have any questions? I know I had to rush through it because I needed to respect our time and also give time for Dr. Ed to talk about his topic.
Yeah, yes, I have a question. Thank you, Doc.
Yeah.
Good evening. Yeah, thank you for the lecture. So, I know that like in these statistics, something like when we're solving like U-word questions,
Yes.
sometimes for all these t-tests, the chi-test, sometimes you see them talking about it like quantitative, qualitative, independent, something. So I really, up to now, that's kind of confuses me. And I'm wondering, is that just for literature? When we're doing research, do we have to like bring that into the research work, or is it
Well,
something?
so the thing about it is that when you're doing like main research, the good thing is that you don't have to calculate all these things because we already have, obviously we're more advanced. There are like things like AI where you already have programs that will already analyze or will calculate all these things for you, whether it's Z-score or T-score or but the reason why we're trying to understand this concept is because when you're reading like literature or all of that, you have to understand what's going on or what they're talking about when they tell you about like, oh, T-score, Z-score, T-test, ANOVA, chi-square, and all of that. But basically, just to quickly answer your question. So for example, if you have maybe a population, let's say you have blood pressure in a category of women, and blood pressure in a category of men. Let's say you have 5 men, you have 5 women. Now, if you do an average of the blood pressure in the men and you get the average, that's a mean. And you do an average of the blood pressure in women and you get an average. Now, if you compare, the best way, if you have 2 different means and you want to compare them, so the t-test is a test test that you use to compare 2 means. If you have 3 different sets of people or 3 different categories, if it's more than 2, like let's say it's not just men and women, but let's say you do men, women, and another category, and it's for means, it's for averages as well, you now use ANOVA, all right, which is for more than 2 sets of people, but it's usually, like you say, quantitative because it's measuring a particular number, right? So it's, let's say, a particular number, mean, average, things like that. Now, when it comes to chi-square, you're not measuring a particular number, you're measuring proportion, like let's say percentages. So you're not getting a particular, it's not like one, like value of mean or something. You're measuring like a percentage. You're measuring a proportion, let's say 2/3 of these people. So you're not saying 42, you're saying 2/3, you're saying this percentage and all of that. That's where chi-square test comes in. I don't know if that helps you at all.
All right. Yeah. Thank you so much. Thank you.
Welcome.
Thank you.
Anyone else has any question? I know I rushed through it a bit, so it might be good if you have a question so that I can quickly expatiate on something about like that. Okay, so I mean, if nobody has any questions, I guess I want to assume everybody understood everything, even though I went very quickly. All right, let me see. Yeah, I think Dr. Ed is back. All right, Dr. Ed, I think the floor is yours. Let me stop sharing. I don't know if Dr. Ed is speaking. Oh, okay.
I'm going to add it to the main and then we go from there.